Welcome to the Inner Athlete Podcast, where we discuss all things youth athlete development and youth mentoring.
So, Chris, how you doing?
I'm really well. Thank you for having me.
Yeah, not a problem. For those that don't know who Chris is an osteo, runs his own business down at Parkdale. It's called Parkdale Osteopathy. I can't pronounce it.
It can be a bit tongue-tying at times, but yeah, osteopathy.
Yeah. So tell us a little bit about yourself. Why'd you get into the industry, and what do you do, and how do you help people?
Yeah, so I've been an osteopath since 2000, so I feel like a bit of a dinosaur now. It's been a long time, but I studied at Vic Uni, did my 5-year double degree, went straight into setting up my own practice, as you said, in Parkdale. And over the time, I've enjoyed building up a team. We've got a great team of osteopaths, massage therapists, and we have a bit of a movement sort of studio as well to encourage things like yoga. It's been a great profession so far, very rewarding. Really, I guess I'd never seen an osteopath myself as a youngster, but I was always drawn to something in the health science field. And as I went my way through high school, started to look at professions that would be of interest, and osteo popped up. 22 years later, here we are, so I'm still enjoying it.
That's cool. No, it's really good to see that you're quite passionate and you enjoy what you do. That's really good to see. Now, the reason why I've got you here today is a lot of parents I've been speaking to, they kind of don't know, kids have got like growing pains essentially, or more so they've been diagnosed with whether it's Osgood or Sever's, along those lines, and they just kind of don't know what to do or what the signs and symptoms might be and how to treat it and how to look after it. And there's a lot of information online, but I figured I might as well bring the horse himself and to be able to talk about it. To kind of break it down for us in terms of what can a parent see, or what they would notice in their kid, or what would the kid notice if they are experiencing Osgood or Sever's?
Yeah, sure. Yeah, and this is clearly a condition that is prevalent, and it's definitely amongst the adolescent age group when bodies are developing. And it's certainly been probably more prevalent in light of what we've been experiencing these last few years. So we've been in lockdowns, we've been denied as much access to formal sport. All of a sudden, we're out of lockdown, hip hip hooray. We try to load up our young developing bodies, and sometimes those tissues in key areas may go, ooh, no, not quite happy. So when we hear these words like Osgood and Sever's, they often come aligned with the word disease as well, and it's so not the case. Yes, we do have some sort of interruption with tissues in the body, but it's not like your leg's going to fall off. It's not that type of disease process. So one of the first things we often need to do is just allay that fear that, hey, you've got a condition that does happen. It does happen on growing tissue. And then what we can do is just break down a little bit more about how we can go about best managing that particular area. So if we do break it down, Osgood is typically an area that involves the knee. And in particular, it involves the key tendon that anchors from the kneecap down to the shin bone, what we call the tibia. So that's Osgood, and it's named Osgood after an American and Swiss physicians back in the early 1900s. So that's where that name comes from. Sever's is more linked to the heel area, where the Achilles tendon anchors onto the bone down there. So what we'll see in these cases is the pathology, the physiology is similar in that we get a pulling load of that tendon onto bone, and where it becomes quite tricky and funky for the individual is it's in an area where there's a lot of growth, like bone growth is occurring. So we look at, for example, in that heel area, there's what we call a growth plate, and that's where our bone cells will start to build from. And so where that Achilles tendon is anchoring onto bone, it's actually sort of juvenile bone. It's almost like cartilaginous at that stage. So we get a lot of pulling on that area. It just stirs it, and if the load is a bit too much, we end up with a cranky heel, and hence heel pain is often the presenting complaint. And then we need to go through the triage of, okay, let's make sure first and foremost that heel pain is consistent with that problem. We want to make sure we're not missing anything else, and then we'll go through the right protocols of how to best manage that case.
Cool. So that's a really good insight. So say if a parent comes in and they're just like, oh, my son's got heel pain or knee pain or something like that. What are some of the things in terms of strength or outputs that you have to change in terms of what they do? So how do you say that there's too much load? How do we manage that load?
Yeah. So we'll often see this condition, and it can be fairly even amongst boys and girls. But what we'll often see is there's a higher prevalence in kids that are doing sports that are more high impact. So more sports that involve jumping, changing direction quickly, accelerating, decelerating quickly. So your classic field sports like your football, soccer, basketball, gymnastics, and so forth are definitely going to be, call it from a prevalence perspective, you're definitely going to be seeing more of those individuals.
It is more represented in those sports.
Yes, absolutely. So can it still happen in a swimmer? Yeah, possibly. You're pushing off from the blocks and so forth. But yeah, we're looking at sort of, the likelihood it's going to be more in those higher loading. And when you think about the role of tendons, they're basically these amazing springs that are absorbing energy and releasing. So if they're doing that over those soft bone edges and they're going to be really pulling on that, again, your risk of stirring it up does get a lot greater with those sports.
Okay, so what do we do now?
Yeah. Firstly, we go, okay, everyone, whether it be the child, the parent, we go, let's all just take a deep breath. Let's just first of all make sure this is exactly what we're dealing with. And as a bit of a segue or aside, we do, part of my role is very much, I want to make sure I'm not missing anything too. So if the symptoms are consistent with pain around exercise, particularly the more loading you do, the more pain is there. We want to then make sure that we're not missing something else that might be more significant, that might require further investigation. So any red flags that come up, we want to make sure there's no constant unrelenting pain, there's no nighttime pain, there's no other changes in that kid's demeanour, there's no loss of appetite, there's no major mood issues. So we want to tap into that too. But we can talk about that a bit more in detail later if we want. But what we get back to is to say, look, this is what I think is happening. Your symptoms are consistent with this condition. So first thing what we need to probably do is just give that area a bit of quiet time. We want to apply measures that might help reduce inflammation. So that might be for some icing the area after their sport. They might need to be preparing before they engage in activity as well. So we would guide the patient through some warm-up procedures to better get blood flow through the region, to get that right tension length through the muscle and tendon complex. We want to then, give them that reassurance that, hey, this is a condition that you may need to manage whilst you're going through growth and also while you're participating in these particular sports. But don't stop. We just need to manage it. We need you to steer you through with a sensible approach. So we need to, look at your training load, look at, is it in between seasons? Are we getting a crossover of other sports? We need to start to look at that side of management as well. But bottom line, it's a condition that typically will be at its worst during your rapid periods of growth. It's not going to be with you forever. So just to help them realise too, okay, this isn't going to be with me, forever and ever. That's okay. I can just, and if I can listen to whether it be my trainer, my therapist, we can get through it. We can manage it.
Cool. So once they've gone through it, what happens there? So they've gone through it for 6 to 18, 24 months. What happens there?
Yeah, so again, our bodies are at that phase again. We're constantly changing and growing, and again, we will be met with spurts different times. So sometimes we do see a spike in pain level around that time. So again, it might be about micromanaging that period. But beyond that, what we want to really try to establish is, have you been able to maintain the best condition for your body at that time? Yeah, so we want to make sure that, okay, just because you've got a sore heel doesn't mean you can't train or you can't, participate in other forms of exercise to look after other areas of your body. So that's where we might just deflect focus. Okay, let's not do the explosive type work, jumping off boxes or doing some sprint work, but hey, we can work on your core, we can work on, shoulder mobility and so forth. So there's definitely other areas that we can keep that that child's focus on.
Yeah, I give the kids the analogy of the white elephant. So the white elephant is, don't think of a white elephant. And what do people do? Think of a white elephant.
Yep.
So if we keep thinking of the thing that we can't do or shouldn't do, then that just manifests into something that, I'm useless, I can't do this, that, and the other. But as you said before, it's more about deflecting or shifting the attention of what they can do. So say, for example, if someone's got a lower limb injury, in this case would be Osgood or Sever's, then we can just get them doing some upper body training. We can do some light loading through the lower half. Maybe instead of doing squats that flares them up, might do some hip thrusts or hip bridges instead, or some back extensions. So we can still train the lower body to some relative degree without flaring up the knee joint or the ankle joint. While still developing them at the same time, because then they're still like, I'm still productive, I can still do something. And once it starts to settle down, then we can start that gradual loading process.
Exactly. And the other things that we're going to look at too is supporting around that area of irritation. So for example, if the ankle's a bit stiff, well, we can work on treatment to mobilise that. We can work on the knee mechanics as well. We might identify, hey, your thigh muscle is just super tight. That's going to be contributing potentially to that pulling load through there. So we can also work on massage to release tension. We can give the patient, exercises and stretches to do. And it's about, again, it's the underlying education to give that person the empowerment to go, well, okay, if I get on that roller, if I use that Theragun, I can help myself, and I can then see the benefits by doing those little micro measures. You are giving yourself that better chance to get back to play, to perform, and to enjoy basically what you're out there for. And that's huge. We don't want kids to feel they're completely shut out from exercise or playing with their teammates. It's about, as you said, deflecting around, take the focus off that so inflammation can settle, but then give them some management tools that they know they need to do. And that's the key. During that it could be, as you say, it could be months, it could be years that you do have to micromanage this. There's no easy way around that, so you do have to sort of step up a bit and go, all right, I know if I stretch my quad before I jump on the basketball court, I give it a quick little go with a Theragun, I'm loosening up that as best I can, I'm giving myself a fighting chance to compete and not then have to miss a week because I'm that sore.
And that's what we see at a lot of kids, that they just miss out on opportunities because they do some conditioning, it starts to flare up, then they're out for a week, and it's just this constant perpetual cycle that they're in. It's like, I can't do this, can't do that, and the other. And it's like, well, speak to your sports coach. I think most sports coaches know that if something flares up, you shouldn't push them. I'd hope so. Most parents will know not to try and push them beyond their abilities as well. Usually most parents will be somewhat protective of that. So then it's really just finding the right person or the right advice or asking the right people around. And usually most sporting clubs should have a physio or an osteo on hand, on staff, in order to refer out and then take them to the clinic or take them to the practice as well. This is probably the biggest thing is parents. I don't think the clubs themselves really disclose that enough. It's like, all right, if your kid is injured, go to the club physio, have a chat with them, get assessed, and a potential diagnosis, or they'll be like, hey, come into the clinic, we'll actually assess you there properly. Then we can actually go through those steps as you mentioned before, go through some tests, ask some more questions, some deeper questions. All right, cool, you've got this is what we're going to do moving forward, and we'll see you back in X amount of time, and we continue to build off that process as well. But this is the reality of the situation is it's going to take some time. I don't know how long a piece of string is, so I don't know how long this process is going to be for you, but it's going to be a lot more manageable and a bit more enjoyable. We just have to bring down your expectations of what you think is going to happen or when you're going to come back. And I think that's the problem with a lot of kids. Their expectations are really high. Parents' expectations can be quite high as well. So we can just manage those expectations, whether it's from a strength coach or a practitioner level. I think that's really going to and say, this is the reality. I've seen X amount of kids, similar position as you. Some of them came back in 3 months, some of them came back in 24 months, back to full strength, but it's more about managing those expectations and shifting the attention onto something else that they can do.
And I think, to pick apart that a bit, support's important, and that's about having like a team around you that provides that. It's almost like a therapeutic alliance. It's about knowing that I've got a therapist that I can trust in what they've identified with me and how they're working their way around taking load off that area. It's about the management of your training load with your coach or at your club, so that you know that, hey, there's still something I can do. I'm still part of that environment. I haven't been shut out from that. It's the impact psychologically it can have. If you were that kid that felt like they just couldn't do anything, that's going to influence potentially your pain experience as well. And that's a whole Pandora's box right there. So, I think it's critical that. And the other thing I was going to just say too, that what we also want to look at is making sure that, okay, there's load that's been building up maybe through the type of activity that you're doing. But let's make sure there's nothing else that may be happening in your body that's contributing to that load. So you're a bit stiff in your back, or your hip range isn't quite there. If your foot type is one where you're rolling in a little bit, what impacts is that having into that heel area? How long have you had those runners for? Do they need to be updated? And those are the other little things that we like to look at too, that might just, from a percentage point of view, it might just make a slight change, but it's better than nothing.
I think for me it's more looking at the compensation strategies as a result. So if someone is feeling a little bit of hip pain, or not hip pain, a little ankle or knee pain, they actually might change their running gait as a result in order to continue on. So it's like, all right, cool. Then something's really going on in that case. Yeah,
and as we know, the motor patterning that's going on in that basically developing brain is important. So if they're setting up, call it habits that might not be optimal for that task, then you got to then pick that apart at some point down the track, and hopefully the patterns haven't become too ingrained that there might be other structures,
secondary issues from that.
Correct.
That manifest.
Exactly.
And we've seen that, unfortunately. Athletes, I had an athlete swimmer I was working with. I don't think he told me in the initial consult, but I found out that he was in a moon boot. I think it was his left foot, because he broke a toe. He did something stupid at home. Anyways. And basically his left side, so between like his hip flexors and his left obliques, were super tight, super restrictive. And it made sense as well, because because he does life saving, and when he was on the board, he felt like his quads were super tight because everything had just kind of pulled in. Mm-hmm. And on the posterior side, he felt really tight as well. So when we started loosening up through the obliques, through the quads a lot more, then he felt a lot more open and was able to sit back into it a lot more as well. So it's just interesting how one injury can actually manifest into other movement patterns later on down the track. And this was a 5-year difference from when it happened to now. And
this ties in so beautifully with how we work as osteopaths, and it's our philosophy of looking at how the whole body is working. So you start to, we've got, let's say, tissue that is irritable, and we can say the Achilles tendon or the patella tendon. Yes, there's the need to make sure that settles, but what we don't want to see is the body, our very clever brain and body, going, well, if we shift the load off from there, we'll be right. And if we carry on, we may be okay, but then things can still load up in other areas, and that's what we want to avoid. So we're looking, when we get a patient into our practice, we're looking at how the whole body's working and say, hey, did you realise that movement is just a little bit restricted, and that may then have a knock-on effect. So we then work on that, and then we give that patient exercises specific to that area too. So again, it's not just purely focusing on that one tendon or one area like the knee or the ankle.
What's the key message for all parents then?
I think it comes back to that support, and when we talked about that team care arrangement, you're part of it as a parent as well, massively a part of it. So you need to, I think, understand that this is a condition that can happen, and that it's not selective. It can happen to any boy, girl, different ages, and again, different sport types. So I think as long as we can see, yes, firstly, the symptoms are consistent with that condition. Let's use the example of Sever's and go, right, okay, well, we know that the sports that you're doing are potentially flaring up that problem, so we do need to micromanage that. So the parents basically need to firstly have that understanding that training load, competing load may need to be monitored, but we don't want to stop all activity. So we want to find what's the happy medium, as we said before, what's the deflective movements and exercise we can do where the body stays happy. That area has had time to naturally heal and repair, and that's, again, one of the most amazing things our body does, is that innate healing capacity. We're just really trying to give it the best chance for that to occur and not keep stressing it. So really, parents, it's about just support, reassure. You're not going to have this forever. Yes, it may suck right now. It may be quite sore, but look, some small pain relief medication can help as well. Again, sensibly follow the recommended dosages. Always check with your doctor if you're unsure about it. But Panadol, some non-steroidal anti-inflammatories in short bursts are typically acceptable forms of management. Again, the icing after sport of that area has more that analgesic effect, just sort of calms down that real pain, that ache that you may get. And then it's about the next day. It's following up with them. How are you feeling today? Have you been doing your stretches? Have you been doing, getting on the foam roller like, your coach or therapist advised? So it's, again, delicate with, you don't want to be rah at them, but you still just need to know that I'm here to support, and by supporting you, I want to encourage you to keep doing the things that you've been advised. Teenagers, they can sometimes have their own set of rules, and
it's funny. Hard. It's funny because I'm in a different position, because I don't have any kids. You've got teenage kids.
Yep.
So teenage kids don't listen to their parents, but they listen to us.
yeah, and that's true. And I've had many a patient in that might be friends of friends, and they said, look, I just need you to see him or her, just because they're going to listen to you, because in that setting, they're going to be, oh yeah. But at the barbecue the next weekend, when you're around at their place, they'll be looking at you going, yeah, not doing that. But in that formal setting, it makes a big difference. Yep.
Yeah, and we'll probably just shift onto that whilst we're on the topic. What I've noticed is, because we have kids that see osteos and physios here as well, some of them are good with their rehab, some of them, let's be honest, like the average with doing their rehab at home, right? So from your perspective, how can we get kids to improve on these outcomes by doing the rehab at home? Like what specifically can parents do to set up the kids in a position to actually complete the rehab properly, so then they can actually get back into their sport, so then they feel like they're not sending their kid just to go get fixed up, and 2 weeks later they're going to go back again, and it's just this perpetual cycle.
There's an easy solution, Trent. I think we just make TikTok an exercise platform, because the kids are all on that. If they follow that, they'll be fine. It's a tricky one. Look, I think that movement variation, I think, is the biggest thing that we're harping on in the clinic at the moment. Again, we've gone through periods of lockdowns, homeschooling, kids have been sitting on iPads, laptops for far too long. They need to shift and change what their body's doing, and that, again, just morphs into, from a sporting perspective, yes, you're moving your body around. If you then need to have that period of rest, if you are, nursing an injury, you can still move other parts of your body. So it comes back to what we were sort of mentioning before, deflect, but then move and vary the movement, vary the load that's going through those areas. I think that, it might come down to, outside of the sporting realm, well, what's the child doing at home? Are they riding to school? Are they walking to school? If they're carrying a backpack, what's the load like? So are there other sort of external factors like that might be influencing them too, that you can sort of tap into as well? I think it's, again, that challenge of, you don't want to be that pestering parent, but you do want to know that your best intentions and interests are in your child. So you don't want to be ignorant, head in the sand with it. You still need to be sort of showing some sort of interest in how they're going about their own management. And it's a bit like, it's that the challenge too can be, are we dealing with like an 11, 12-year-old who has the maturity level of a 15, 16-year-old versus a 16-year-old who has the maturity level of an 11-year-old? So you've got to sort of read the room a little bit like that as well. But I think it's important to have the pillars around that child, whether it be parents, coaches, they need to be almost like lighthouses. They need to be that beacon that they can go to air any concerns that they have, because it can really, play on their developing brain as well. They get anxious about it. They fear. They think, oh, next time I go back on the court, what might happen? So you've got to know that there is support there. They've got to know that, hey, there might be a bit of pain. Okay, and this is an important area too. When you do put load back through that area, expect a bit of discomfort. But when we talk about, well, maybe preparing before you exercise, you might just do some dynamic stretching. You might, again, get on the roller lightly to release some tension. But you might still be met with a bit of discomfort when you first start moving, and then it starts to warm up and free up, and then things feel a lot better. But knowing that there's still got to be a bit of a capping point as to what, for that individual, what's your sort of ceiling? Where should you find your pain level should go to before you then go, oh, actually now I need to stop. I need to actually reassess and understand that pain signalling is now telling me that I need to listen to it.
Yeah, I think there's a couple of things, because as I mentioned before, we're in a really unique position as strength coaches. The one thing I have noticed, when kids come to us, we can actually just prescribe the rehab within the actual warm-up itself, which is a really kind of unique position. And because they're in an environment like this, like a training facility, it's like, well, it makes sense. If I'm here to train in a training facility, I'm here to train.
Yep.
So then the kids are more likely to do that. Then obviously we can do that with them. We can show them what to do, make sure they're doing it well, do it with them as well. But as you mentioned before, like that, the parents being a beacon, I'm not too sure if any parents have really thought of this. Maybe just doing the exercises with the kids. Because if it's 15 minutes of rehab, maybe just do it with the kids. And actually, when the kids are being shown what to do, maybe you do it at the same time as well. So then you know what to do as well. And I think it's more, and if you're that lighthouse or that beacon, right, you're trying to lead by example for your kids as well. So you're trying to set up, all right, if my dad's doing it or my mum's doing it with me, then, it's like, all right, then begrudgingly they'll probably end up doing it as a result, and then it becomes more of a team thing as well. And then you got kind of something to as a parent and with your kid, you get something to bond over, because we do have actually, even when we training here, we have mothers training with their daughters or their sons, or fathers training with their sons as well, or even daughters. And it's kind of interesting, even though they're doing separate programs, but they just kind of like see each other. It's like, oh yeah, they're training hard, they're pushing themselves, so I better push myself a little bit harder.
Yeah, I couldn't agree more with that. And I think that was a good example in our lockdowns, where we had to, we couldn't go to gyms, so we maybe did some online exercises. And I had many a patient that would say, yeah, I've started doing that. And, funnily enough, my son or daughter has just joined in. So that's exactly the type of, modelling you want. And yeah, it's amazing. The kids are obviously looking up to parents, and they're seeing so much of what they do. So if you're seeing a parent more often in activewear rather than sitting, with Ugg boots and, tracheodax on the couch, you're certainly creating that great example then to sort of set the scene.
Yeah, and I've seen this in the past. I've been injured a few times myself, and you might see like a teenage kid with their parent or something like that as well, and the parent's just sitting there, bit disinterested in terms of the kids' rehab. And if the parents were just like engaged for that half hour, 45-minute consultation process, I think you'll start to see better outcomes, because if the parent understands what's going on, that means the kid's going to pick up that they're invested in you, not just there to slap X amount of dollars and all that jazz and just drop you off, be on your phone, answer emails and all that. That you're actually engaged in your kid's health, because essentially you're engaged with their physical health and well-being.
Yep, definitely. And there's also obviously different ways kids will be learning. Some kids are more visual, some kids are more, they just need to hear, audibly, do this. But the ones that, can see, if they can see a picture of what that, that tendon's doing down to that area, if you get that little bit more detailed education, and it doesn't have to be all, sciencey, jargony. It can be really broken down into, hey, that's pulling on that, it's pissing it off. we've got to stop that right now, but know that that won't be forever. But right now, we need to calm it down. And you just got to just be a little bit more direct sometimes as well, and kids will then feed off that. So we don't want to get caught up too much in the whole pathology of it all and so forth. We just want kids to be able to enjoy sport with as minimal amount of pain as possible, and reduce risk of injury or compensations as much as possible. So yeah, I love it when parents are in on a consult, because they can then hear the same information. Again, the more the household hears it, as you said, it might just pick up that level of compliance. So you're then going to be, facilitating, I think, a much better healing response to what's going on.
Cool. And if people want to come and see you at your practice, where can they find you?
So we're in Parkdale along the shopping strip, Como Parade. The easiest way I will often say how to find us is we're sitting between two amazing facilities called Burger Lab and Parker's Pavilion. So we're sort of like the meat in the hospitality sandwich, so to speak. Very easily accessible. As I said, it's been over 20 years we've been in operation. We love treating all kinds of musculoskeletal problems, but we do definitely really enjoy that challenge of having kids coming through and really helping them best understand what's happening with their particular condition, and again how they can best go about managing it, and then ideally future-proofing as much as they can as well. So we love that whole find it, fix it, leave it alone type approach, but that there's ongoing support should you need it down the track.
Yeah, you can find these guys online as well.
Yeah, parkdaleosteo.com.au. I think we do, not that I'm all over it, but I think we do have Instagram as well. But yeah, we've got a Facebook page as well. That's definitely would be more than happy to help anyone out. And shout out to you guys as well here at Inner Athlete. You guys are doing amazingly good things with your young kids. It's been a pleasure having you guys out to our clinic as well. So it's been great networking with you guys. And I think that hopefully parents will get a little bit out of today from that point of view that these things happen, but there are people out there. There is that support around that can really help guide the young kids through what can be a little bit of a challenging time.
Yeah. If you like this episode, please leave a comment, like, share, all that lovely stuff. It really does help us spread the message of how can we best support parents and youth athletes in their journey towards success and whatever that may be for them. So until then, we'll see you next time.
You have just listened to the Inner Athlete podcast. Be sure to subscribe to stay up to date with the release of weekly episodes. Be sure to follow us on Facebook and Instagram to get great tips on all things youth athlete development and youth mentoring.